Hello and welcome to the Longevity Lab. Today we're uncovering something that you've likely never heard about, a groundbreaking healthcare project that had the potential to absolutely revolutionize our entire system, yet somehow it disappeared from public knowledge. If you're an executive, a business owner, or someone responsible for the healthcare decisions of your company, you need to hear this. Let's get into it. Hello and welcome to the Longevity Lab. I'm your host, Dr. Jay Hitson. Today, one of the things that we're going to be talking about on the Longevity Lab is rising healthcare costs. This is really important to overall longevity because if people are living longer, but they're living longer sicker, it's catastrophic to our nation. We're already under crippling debt and crippling economics of what our healthcare, or more like a sick care system, is costing us. And there are so many different corporations, and I'm talking to so many executives who are getting their benefits packages and looking at how year after year the healthcare benefits that they're trying to provide for their employees, the costs just keep going up and up and up. The benefits are not any better. And here's the worst part. You're spending so much more money and your people aren't getting better. You're not seeing these healthy, thriving, full of energy and mental clarity, workforce out amongst your team. What we're really seeing is people are just declining, but yet we're spending more and more money for that. Today, we are going to talk about something that I bet you have never heard before. And we're going to get into maybe why you've never heard this before. I don't really like to get into conspiracy theories, but sometimes you almost have to just wonder. If you are a business owner, if you are an executive or HR, and you are one of the people who has been put in charge of looking at your healthcare benefits and what do we do about these packages, stay tuned because you are going to want to hear this. So I have this report that I was able to dig up, and luckily I heard about it years and years ago, and I printed it off because this particular report has been eliminated from the internet. So I'm going to tell you right now, I'll tell you where you can go to kind of find this, but I'm going to tell you, you have to know exactly where to go because there is no search engines that will help you find this report. But here's what's happened. So back in 2000, so it looks like it was 1999-ish, 2000, there was a project from a company called AMI that was apparently they were like a subcontractor of Blue Cross Blue Shield. And what they were doing is they were running kind of, we'll call it an experiment. It was an experiment because it was a real project. It was a real plan, a real healthcare plan that they were testing out in the Chicago area. This particular plan, when it was launched, it says here that there were 600,000 people enrolled in this different healthcare plan that they were testing out. And essentially, what it was, they were looking at all of these rising healthcare costs, and they're like, we got to do something. Let's try switching up the primary care model. And so what they did is they just switched up the type of physician you saw as a primary care physician. And from what I can tell from that was about all they changed. So what they did is instead of your point of entry, so when you are going into the healthcare system, I like point of entry. That's a great way. So what's your first stop? Your first stop is usually your PCP, your primary care physician, your family doctor. And that's usually the person who kind of navigates you. Okay, you need blood work. Oh, you need to go see a specialist. Oh, you need this treatment. You need this diagnostic. It's the person who directs you into the healthcare system. They changed that primary care physician from being a traditional medical, like MDDO, to what they call a CAM-oriented, which is basically somebody who is like a medical doctor or DO who is also very, very familiar with natural interventions. Was very, very good and very accepting of non-pharmaceutical interventions. Now, from what I see from the research, they had a hard time finding enough of them because a lot of people were really interested in this. Even back in the early 2000s, people were really interested in this. So what ended up happening was they had to get more, and it looks like they had to recruit a lot of different types of physicians. I mean, I saw on here it was somewhere like they even had to recruit some like physical therapists to kind of filter this role, chiropractors to filter this role. And so it was just this variation of different healthcare practitioners who were licensed physicians, understood the basics of primary care, and they became your PCP, and that was the plan. That was the healthcare plan, and then they could make recommendations from there. This plan went for a 7-year period, and here's the point. Here is the bombshell that I'm going to drop on you. Their goal was to reduce healthcare costs. So your question is, did they succeed? The answer was yes. Their reduction, they were able to reduce hospital admissions by 60.2%. They were able to reduce hospital days stay by 59%. They were able to reduce outpatient surgeries and procedures by 62%. Now here's the one that is going to blow your mind. Pharmaceutical costs dropped by, and I quote, a remarkable 85%. Now just think about that from the standpoint of your company, your corporation. Your premiums are based on utilization. So if you are spending a lot of money, your premiums are really high. If you're spending very low, your employees are not utilizing these high ticket procedures, your premiums come down. Can you imagine? I mean, like if you just take the average, I mean, this is conservatively 50% decrease in utilization. I mean, it is radically transformative. I know I've been talking to a lot of the corporate insurance agents who are writing these policies, and the people who are in the actuarial sciences who are doing this, and and they're just blown away. Why haven't we heard about this before? Now, let me also just state in this research, number one, like some of the counter arguments that I've heard is like, well, of course it was probably all these healthy people who signed up for that, because these healthy people would be the ones who would want this different point of entry. They want different options. They would not want to go straight. Actually, whenever they surveyed the individuals, most of these people, actually the 600,000 to 700,000 people who participated, they actually classified themselves as being either medical failures or less healthy than the average, which is quite astounding. So one of the many things of how this program worked is that these primary care physicians, these alternative primary care physicians, were given the ability to get into things like diet, exercise, structural, back problems. They were able to talk about that. They were able to do that. They were given the leeway to get into behavioral and emotional problems and get into, early onset physiological disease processes. And when they're talking about it, they said, at first, yes, the costs didn't go down day one, which kind of makes sense. They said at first, the costs kind of stayed level, if not, they went up a little bit because people were onboarding, people were using the nutritionist, people were using the physiotherapy exercise programs. So there was some increase in costs. But think about that from within a 7-year period. And actually, it says even within year one, they already started to see a reduction in overall costs. It's absolutely outstanding. So here's one of my questions. Again, this is documented. This is in JMPT. Why is this something that we are hearing about? Like, why is this buried? There's a lot of reasons. And let me be very, very clear. I am highly aware that if you reduce pharmaceutical usage by 85%, that radically impacts the economy of the United States. No, there's no two ways around it. But can I make this point? Our nation has been through radical transformations before. There have been things that were huge economies, 100 years ago that virtually don't exist anymore. And we've survived as a nation. I understand that, yes, that would radically shift the entire Dow Jones and the big Fortune 500, the Fortune 10, it would radically shift investments. I understand the economic impact and how that can be terrifying. But from an optimistic standpoint, if we had a healthier nation of individuals who felt great, mental clarity, had energy, had stamina, could we not come up with something better, something that actually, benefits humanity as opposed to hinder our fellow man? I mean, this really is such a beautiful foundational point for a corporate wellness healthcare reform. These very, very simple principles can be brought in at an extremely economic price point and radically shift overall utilization. I'm going to be very clear. I am no way advocating that we get rid of, all medications, that we get rid of, our urgent care, our ERs. Those are absolutely essential parts of our healthcare system. But if we can decrease utilization by 60%, and what if, and here's the real principle that I took away. Before you get the medication, you have to try some diet things. Before you can go and get that surgery, you have to try these other therapeutic modalities. Now, I understand, physical therapy has been kind of a precursor to a lot of surgeries for a long time, but I think we wait sometimes till it's way, way down. We wait till the joint is almost destroyed, and then now we're going to try a little physical therapy as a preemptive. No, let's just catch it so much earlier. I mean, just from a standpoint of a joint, like a bad knee. When somebody is unable to walk properly, how does that impact your exercise? Now, how is that impacting your overall health? How's that impacting your cardiovascular system, your lymphatic system, your immune system, your cognitive, your joy and your happiness? Especially whenever most people, it takes, 10, 20, 30 years to wear that joint down. 10 and 20, 30 years of extra pain and lack of mobility. What does that do to us? And what if part of the primary care process is just catching that one thing early? How does that shift? And again, this study was only 7 years. They didn't have a chance to even look at what it would look like 30 years down the line. I would love to have seen that. So when we look at, we can't necessarily, reform the entire governmental system. That's a little bit obscure. But within individual corporations, you could absolutely see how you can change an entire culture to, before we go this direction, we're at least going to give these other things a try. We're going to give diet a try. We're going to give exercise a try. We're going to give some very basic lifestyle changes. We're going to try just this supplement. Because, what if that omega could reduce the cholesterol 10, 20, 30 points? I see that every day on the labs. You have some phenomenal different supplementations that absolutely move the markers on these fundamental baselines like cholesterol. What if you just had to at least give those a good shot before you move forward? Now, one of the arguments that I hear very much from the traditional healthcare community is people don't want to do that. People just want a magic pill. People just want to be handed something. They don't want to try. They don't want to exercise. It's almost like it's almost a presumption that you're too lazy to take care of yourself. I don't believe that. Now, is there a population out there who fits into that? Sure. But they're not the majority. I really, truly believe that if you give people the tools and you give them a right culture, you surround them with people who are also doing right things, they'll start doing right things too. It's the way it works. Today, I had to go to a meeting that was very, very early in the morning, and it was extremely dark outside, and I didn't know where I was going, and I wasn't sure what I had to do, but you know what? I just kept following the crowd, and it ended up where I was supposed to go. That's the way we are. If we have a crowd all going one direction, if you're in a corporate environment and everybody's kind of going one direction, you naturally just kind of get in line and you just do what they do, and it's easy. It's natural. It doesn't take really any effort. I'm in the age where I have adult children, and I'm looking and thinking about, the next generations. And can our grandchildren really afford to inherit this healthcare system? If you're one of the people looking at these premiums, you're going to say, no, it cannot keep going this way. We can't have double-digit percentage increases year after year. It's unsustainable. The research is right here. Why can't we build on this? I'm sure there's improvements. And personally, as I look through how the program was laid out, I would make some additions and fine tune some of these different areas. And there's always room for improvement. So as you are just thinking about this and processing it and looking at it in terms of what does this mean for you? There are already thousands upon thousands of physicians who are operating like this. This is something that could absolutely spark a complete transformation in the economics, not just of the healthcare system, but the economics of corporations. I thank you so much. I appreciate the opportunity just to share something with you that has been on my heart for so long, and something, again, that you may just not even know that it's already been done. It already exists. Now let's just build upon it. So thank you so much. I'm Dr. J. Hitson, and this has been the Longevity Lab. I hope this conversation sparks some new ideas and opens your eyes to what's possible for the future of healthcare. We don't have to settle for skyrocketing costs and declining health. We have solutions, and it's time we start using them. If you're a business owner, executive, or the corporate rep responsible for healthcare benefits, and you've been tasked with finding more cost-effective solutions, reach out to us. There are simple, proven strategies that we can learn from this project that can directly impact your bottom line and improve the health and performance of your people. If this episode resonated with you, share it with someone who needs to hear it. And if you want to stay connected, follow us at GoodDoctors.Health for more insights, resources, and strategies to optimize your health and longevity. Thank you for tuning in. Until next time, stay sharp, stay healthy, and keep challenging the status quo.